Okay, so we've had a patient come in here. I've been to the dermatologist and complaining of a wart on their foot. But we've had a closer look and it looks like a corn, so the dermo sent them in to us to get this checked out. So as usual, we go ahead and cut away the callus cap on this just to make sure. Sometimes it's a little hard to tell if it's a wart or a corn. So we go ahead and cut this one away. It's clearly this one's a corn already. So we get rid of that callus cap and you can see that it's got this really, it's a little bit hard to see in the picture actually, but if you actually see in real life, it's got a sort of translucent look to it and you can actually see the pretty well defined edges. So we'll go and trim out as much of that callus cap as we can. So we're only going to be really trimming out the apex of the corn. Now, sometimes when we trim these out, we get a little bit of blood. Sometimes not. Obviously, we try and avoid the blood because it's an infection risk because the foot's close to the ground, which is quite dirty. So if they go and walk in dirt or dust, it can get infected. But now what we're doing is using a number 15 blade. It's a Swan Morton single-use blade. We go and trim around those edges. So we're trying to trim the border between viable and non-viable tissue because you can see the difference in the way the skin is. The corn looks more like beer bottle glass, like the traditional brown beer bottle, and the regular skin looks more pinkish or white. So we go and trim around that edge, and this one is a little bit sore because this is the first time we've ever done this one on this patient. So she's been walking around like this, limping for about 2 months now, she says. So just have to be a little bit careful with this because sometimes on the first visit, if we take too much out, it'll actually make it worse. So sometimes what it's better to do is to take as much as we can get out without using any anesthetic, and then maybe see them in a week or two's time and then remove a little bit more. And it's just a more painless way to do it rather than try and get it all out in one go or have to anaesthetize the foot to take this out, which we very, very, very rarely do. But it looks like she's pretty tough and we're going to be able to get this one out with no anaesthetic and just sitting in the chair here. You're right. It's it's looking good. We might have already got a little bit of blood there by the looks, but we'll just keep going down here. Make sure we try and get this out. We'll try and get it all out in one piece to show you if it's not going to hurt it too much. But yeah, usually these are caused by pressure. So you can see that's the actual corn there. So that's been under the callus cap. It's quite a big piece. That will be all we'll take out. We'll go and just smooth all that up a little bit now with the scalpel, and then we'll dress that one up because there's that little spot of blood. And then we'll probably review this in about 4 weeks' time and remove the rest of the corn.